welcome back to 843 TV. And now I have Dr. Cox, who is the Executive Director of the VIMS program here on the island. Very nice to see you again.
Thank you. Very nice to see you again, Kat.
Well, our hot topic today is we're going to talk about the vaccines. You know, last time we were here, we were talking that you were having it available at the clinics. So that's probably been about almost a month ago. So an update with the clinics and how people can get vaccinated.
So we haven't had a vaccine at the clinic for a month. We started April 5th. We had some delay in getting the vaccine just because there was a holdup, as you know, not only because of the Johnson & Johnson issue, but also because there was a delay in distributing vaccine from Department of Health and Environmental Control. We were very fortunate that Senator Tom Davis stepped in and contacted MUSC, and MUSC gave us the doses that we needed so that we could start the clinic on April the 5th. So far, we've vaccinated about 500 people. Today, we're going to vaccinate probably another 150 people. So after that, we're going to pause for a week, and then we'll give the second vaccines to them. Now, prior to April 5th, we have a very good relationship with the hospital, so we were actually helping the hospital vaccinate people.
Right.
The reason why we did that was not only so that we could get used to doing the vaccinations ourselves, but also because we reach a different population than the hospital does. And it allowed us an opportunity to bring some of those people in to get vaccinated a little earlier.
You know, that's true. But let's step back for 1 second. I want to talk about the VIMS program. It's Volunteer in Medicine. And so it's a group of physicians and health professionals that are together on the island providing medical services. And it's become really important. I mean, it's been here for, 28
years.
28 years. And so it's been a very important part of our community for a whole population that doesn't have the opportunity to go through a traditional medicines.
Right.
So we have now vaccine 500, right? And now talk about the supply. I mean, they have to come back for their second shot, I'm assuming, correct? And within that population, do you find people are a little bit nervous about getting the vaccine? What's this?
Yes, that's been an issue, particularly in the Latino community. The Black community has a little less vaccine hesitancy. The things that we hear are they want to wait and see. They have some hesitancy related to that. The other hesitancy comes in because anytime they have to take off from work, they lose money. So there's a concern about having to go somewhere as opposed to getting it on site at work. In order for us to address that, our next phase will include actually going out to some of the businesses and to some of the churches to make it easier for people to get vaccinated.
And I also think this is sort of the scary part, the unknown values. When you get the second shot, people seem to have a reaction. And sometimes I've had 2 shots. My first one, it was Pfizer. I had a sore arm.
Right.
I just took some Tylenol, took care of that. The second one, no sore arm, just malaise the next day.
Yeah.
And I was able to take the day off from work just because I was just malaise. But next day I was just fine.
Right.
But other people, they may end up losing a day or 2 of work. Is that is that their fear?
Yeah, and that's a major issue for them. Many of them are in jobs that are low income, and they're basically having to work paycheck to paycheck in order to be able to make ends meet. So they really can't afford to take any time off. So we have to come up with ways to make it as easy as possible for them to get vaccinated. So that's why I said we're going to be working on that going forward. You mentioned a little bit about Volunteers in Medicine, and I'd like to back up a minute if you don't mind.
Sure.
So yes, Volunteers in Medicine has been on the island now for about 28 years. It's the brainchild of Dr. Jack McConnell, who started the clinic along with many of his physician friends. One of them, I understand, was your father. Is that correct?
Yeah, that was 20 years ago.
Yeah.
Something.
So we've been very fortunate to get some very talented healthcare professionals, as well as over 600 lay volunteers, to help us provide and to understand and serve the health and wellness needs of the medically underserved and their households who live or work on Hilton and Fusky Island.
Well, it's a great part of our community. So let me talk about the day in the life going into the clinic. I mean, it's really interesting. I've now spoken to several of the doctors who volunteer. I mean, we have surgeons and people who've been head of departments of hospitals, and they're now in the clinic, providing a simple care. I don't know if it's simple care. All care is but treating a flu or treating or giving a vaccine or vaccination. So when somebody comes into the clinic, what do they expect? So maybe we can help them with the fear, if they're afraid of something. So
that's a good point. One of the things we're very fortunate in having is we have some very talented physicians. As you said, many of them were at the top of their profession when they retired. Living in this community, we get a lot of what I refer to as PIPs, previously important people. So, and that's true of our physicians as well. We have over 100 physicians representing 23 medical specialties. So we're actually like a large multi-specialty clinic. The good thing about that, particularly for the community that we serve, is that it's a one-stop shop. They can come in and be seen for different problems by different physicians at the same time, as well as get their medications for free. So,
that's important. Do they dispense it there as well?
Yeah, 80% of the medications that we dispense come right out of our pharmacy, and the reason for that is that we have a relationship with pharmaceutical warehouses that give us medications for, not for free, but for markedly reduced price.
Right, exactly. And where's the location? If somebody's watching us for the first time.
We're at 15 Northridge Drive, which is right across from the Northridge Cinema, and Ray's Cafe is right across the street from us as well. Island Imaging is in that building as well.
Great. And are you open all day? 7 days a week or 7 days?
We're
5
open
days
Monday
a week?
through Fridays in the mornings, and then we're open Tuesday and Thursday afternoons. You mentioned something about what types of patients that we treat. We have some very complicated patients, and the reason why we're able to care for complicated patients is because of the very varied skills of the physicians that we have. We have large chronic disease management clinics for hypertension and diabetes. We have over 500 diabetic patients and over 7 hypertensive patients who have multiple medical problems. We're able to manage them on an outpatient basis, and that saves the hospital millions of dollars because these patients then don't end up in the emergency room. It also keeps our patients at work and our students in school. So.
Well, exactly, and that's what is so important about the whole thing. It's helping the community, each other, and helping a person who has a chronic disease and allows them the ability to be the best they can be.
Right.
And then giving them the courage and also the opportunity to have the medicines.
This is a very giving community. We're very fortunate to live here. People have stepped up and not only donated funds, but their time and their talent to take care of people who are less fortunate. And that really makes me feel good about working at Volunteers in Medicine.
I agree with you. I have a great regard for all but that. So I have a couple more minutes with you. So let's go back to the vaccine, because everybody get vaccinated. That's what we want to encourage here.
Right.
Don't be afraid. Go to the clinic. Is there a way for them? So when will you get your next batch of vaccines? So will they know? Is it to come in or make an appointment? Can they walk in, or they need appointments? Actually.
So right now we have plenty of vaccines. So for example, today we're going to have excess vaccines. So we've already put out a notice in the Island packet and on Facebook, so that we make sure that we use every bit of vaccine that we have. Going forward, like I said, we're going to do the second batch. After that, we're looking for ways to be more intentional about how we vaccinate people, because we're now at a point where having these large clinics in the hospital seeing the same thing really isn't very productive. We need to look for ways to get vaccine out to the community. As you said, we need to do a better job of communicating with people and helping them overcome their hesitancy about getting the vaccine. A lot of times it has nothing to do with fear or side effects, as you mentioned. But the type of questions we get are things like, will this affect my ability to get pregnant? What are the long-term side effects? You mentioned having illness after the second vaccine. That's more common with Moderna than it is with Pfizer, for example, but it's very limited. And quite frankly, it's a sign that your immune system is working. It's not that you're getting an infection, it's that your body is responding as if it were an infection, which is exactly what we want your body to do. That's the whole point of giving you the vaccine.
And Dr. Cox, I think your point that's exactly right. And I really want that point to understand to our viewers is that it's working. It's all working for us.
Right.
Well, Dr. Cox, I want to thank you for joining me today.
Thank you. It's been a pleasure being here and seeing you again, Kathryn.
Nice to be here. All right, and I want to thank you for joining me. This is WHHI-TV, where communities come to speak. We'll see you next time.